Hey guys, this is Dr. Herb. Today we are going to compare the genital ulcers. So to begin with, we start with the genital herpes. So genital herpes, the IP. The IP stands for the incubation period. It is from 2 to 7 days. Next we look at the causative agent. So what is the causative agent of this genital herpes? The causative agent is nothing but the HSV2 greater than the HSV1. So how is the clinical presentation? The clinical presentation, there are a cluster of vesicles. There is a cluster of the vesicles. So these vesicles are on the erythematous base. They are on the erythematous base, and there is also painful and pruritic lymphadenopathy. There is a painful as well as pruritic lymphadenopathy. Next we'll move on to diagnosing this condition. So in terms of diagnosis, there is the sang smear. There is sang preparation. So this sang preparation shows multinucleated giant cells. There is multinucleated giant cells and on PCR. So how do you treat this condition? So the genital herpes is treated by acyclovir. So genital herpes is treated by acyclovir. Then there is also the famciclovir, acyclovir, famciclovir, or the valciclovir. Next comes the syphilitic chancre. So what happens here? So in case of the syphilitic chancre, the incubation period, so let's write it down, syphilitic chancre. So here it is the hard chancre. So then comes the IP. IP here, incubation period is 10 to 90 days and average being 21 days. Then what about the causative agent? It is the Treponema pallidum. This is the syphilitic chancre. So there is Treponema pallidum. So next the question arises, how is the clinical presentation? So when you look at the clinical presentation, it includes the single painless ulcer. It includes a single painless ulcer, and this is with the clean base. So this is with there is a clean base and a firm raised border. There is a firm raised border. There is also presence of a painless lymphadenopathy. Painless lymphadenopathy. So how do you diagnose this condition? So diagnosis of this is by the clinically. So it is clinically diagnosed. So how do you treat the syphilitic chancre? Syphilitic chancre is by the administration of penicillin, as well as there is a ceftriaxone. Next we move on to the donovenosis. Donovenosis or the granuloma inguinale. So here this has an incubation period of 1 to 12 weeks. So it has an incubation period of 1 to 12 weeks. So what is the organism here? The organism here is nothing but the Klebsiella granulomatis. So it is the organism is the Klebsiella granulomatis. Then comes the clinical presentation. So clinical presentation, it is by it has a painless papule. So there is a painless papule, or there is a nodule. There is a painless papule or the nodule, and it erodes into a beefy red granulomatous ulcer. It erodes. This is into a beefy red granulomatous ulcer, and there is a rolled edges. There is presence of rolled edges. Here there is no lymphadenopathy. There is no lymphadenopathy, and the pseudo buboes, they are seen. So how do you diagnose this? Diagnose and the treatment. So diagnosis would be by the Donovan bodies, and these Donovan bodies, they are seen on the biopsy. So how do you treat this condition? The treatment is by, there is administration of the azithromycin. So you can administer azithromycin as well as the doxycycline can be given. Next, we are moving on to the chancroid. So in case of the chancroid, it is known as a soft chancre. So here the incubation period is about 1 to 14 days. So what is the causative agent? The causative agent is the Haemophilus ducreae. Then comes the clinical presentation. So how is the clinical presentation seen? So the clinical presentation, it is nothing but a painful ulcer. That is, the ducreae makes you cry. And there is also painful inguinal lymphadenopathy. There is a painful inguinal lymphadenopathy. So then comes, how do you diagnose? The diagnosis of chancroid is by clinically diagnosing. And how do you treat? The treatment of the chancroid, there is a soft chancre, you give azithromycin. So there is administration of azithromycin as well as a ceftriaxone. Next, we look at the LGV. So what happens to the LGV? So in terms of LGV, the incubation period, IP is nothing but the incubation period. The LGV, it is 3 days to 6 weeks. So what is the organism involved here? That is a clinical agent. It is the chlamydia. So it is nothing but the chlamydia, that is the trachomatis. So chlamydia trachomatis, and it is the serovirus, chlamydia trachomatis serovirus. So this includes the L1, L2, L3, and there is the clinical features or the presentation. There is the painless genital ulcer, whereas the chancroid was painful. This is painless. So painless genital ulcer. So there is a painless genital ulcer, but there is a painful inguinal lymphadenopathy. There is a painful inguinal lymphadenopathy. Next, we look at the diagnosing. So diagnosing this will be by the nucleic acid. So there is nucleic acid as well as the amplification test. So how do you do the treatment? The treatment is by the doxycycline. So this was about comparing the genital ulcers. We saw the genital herpes, we saw the syphilitic chancre, that is the hawk chancre. We also saw the donovanosis, granuloma inguinal, and the chancroid and LGV. To learn and grow daily like this, please do subscribe.